Stand by.
Today on Community Watch, our guest is Dr. Leonard Reeves from the Medical College of Georgia. He'll be talking about some pretty impressive programs that are available to students right here in Rome. So stay with us.
That's low, that's low. That's low and below.
Look, he's blushing.
Seriously. Okay.
Welcome to Community Watch. Looks like you've got me solo today. Greg has got a work commitment, and so he'll be with us next week. I'm sorry he's missing today's show because it's going to be a really informative one. In just a minute, we'll be joined by Dr. Leonard Reeves from the Medical College of Georgia. And not too many people realize that we have a campus of a sort, a mini campus here in Rome, and a lot of opportunities for students right here in our area. So we're going to find out today about what those opportunities are and understand a little bit more about Medical College of Georgia's presence here in Rome and what they're all about. So I want you to stay with us and be ready to take notes because it's going to be fascinating. And we will be back with our guest right after this very short break, so don't go away.
Your life is filled with opportunities to show the world you can take charge. It's waking up each day with a mission. It's working each day toward a goal. It's choosing to rise. It's charging forward with a purpose. It's changing the course of your life and taking charge of your future. If you're ready to be a take charger, enroll at Georgia Highlands College today.
Welcome back to Community Watch. We're very happy to have with us today Dr. Leonard Reeves. Welcome.
Well, thank you very much. I appreciate you having me on your show today.
Well, I'm going to have to read this. Your actual title is a pretty good-sized paragraph.
It takes 2 business cards.
I can't imagine. But you are the Associate Dean of
Yes.
the Northwest Clinical Campus
There you go.
of the Medical College of Georgia.
At Augusta University.
At Augusta University. I left part of it off.
Well, you know, I leave the at Augusta University off because we're in Rome.
Right.
And a lot of people still don't realize it, but we've been here, I think we're about to graduate our 7th class.
Whoa.
Yeah, we've been here a very, very quiet force in town. A lot of your viewers may not recognize that we're here, and they may not totally understand what we're all about. So I thought maybe I'd give you a quick overview of what medical school is. I've for the past, I guess about 6 years now, I've been sitting on the admissions committee for the Medical College of Georgia. And during that time, I have realized, the quality of students that we're getting now. These students have done a whole lot in their undergraduate, including research. A lot of these students now have had journals published and that sort of thing, just to get in medical school. And then once they get into medical school, the first phase of medical school is what we call basic science. And in basic science, you learn about the cellular ideas of how life happens. You not only learn about the normal anatomies, but you learn about the abnormal. And so you start to putting together all of the complex structures of the human body and what can go wrong with them. So in terms of what most people would think, that's probably more like book learning. But then when you get into your second phase, which is your clinical phase, that's when you actually start seeing patients and start working with patients. And that's what we do here. We take what we call our third and fourth year medical students, and they come to Rome, and we pair them up with local doctors, surgery, OBGYN, family medicine, internal medicine, neurology, psychiatry, pediatrics. So those 7 major areas of study then are what they do here in town. Now, in most places around the state, and we do have other campuses, we have the 4-year campus in Augusta, which is what everybody normally thinks about with the Medical College of Georgia. Then we have a 4-year campus in Athens, which is a partnership campus with the University of Georgia. And then we have clinical campuses, not only here in Rome, but we also have a clinical campus in Albany, and a clinical campus in Brunswick, and one also in Savannah. And I'm hoping that soon we're going to have one in Dalton, Georgia. So we'll have 2 in the northwest corner of the state. And this is where our students get their interaction with patients. Now, in most of the other areas, they'll spend, I believe it's 6 weeks in internal medicine and 6 weeks in family medicine, and so many weeks in each one of these. But we do it differently here. We're the only campus in the state of Georgia, and it includes all the medical schools, that does what we call a longitudinal integrated curriculum. Now, a longitudinal integrated curriculum is something that if you've seen one of these campuses, you've seen one, because they're all a little bit different. It has been something that's been done at Harvard for a while. It's been done for more years than Harvard, though, in a little bitty place called Yankton, South Dakota. I actually went to Yankton many years ago when I was setting up this campus, and I was very impressed on how their students followed patients all year long. Because when it comes down to it, a patient isn't just an internal medicine patient. They're not just a family medicine patient or a pediatric or whatever. They are a combination of all of these things. So you can have a patient that goes to surgery, and then they wind up having to go over to oncology, and then they have to come back around and they may have a neurological deficit that need to be seen by neurology. So you can see how one patient will flow through all the different specialties that the student needs to study in. So what we do here in Rome is that we take the students and we say, you're going to follow patients all year long. I always say that it's sort of interesting. I always say that you can't follow a woman all the way through her pregnancy in 6 weeks. It takes a little longer, probably about 9 months most of the times. So what we do is we pair our patients up with young women that are early along in their pregnancy, and we have them follow them, because sometimes there may be, sicknesses in the middle. Sometimes that you wind up and you find out there's twins, that sort of thing. And then they follow them not only through all of their prenatal visits, but they're there for the delivery of the baby. And then they see them after they're delivered in pediatrics, where the mom and baby come back together for their first checkups. So you can't do all that in a very time-constrained manner, but if you have them for an entire year, you can follow people like that. So that's what we do. And what we have seen is that we have great success with that, and that we have graduated now, like I say, I think this is our 7th year, but we've graduated family physicians, internal medicine docs, neurologists, graduated an ophthalmologist, we graduated an orthopedic surgeon. I mean, you name it, basically, and we've been able to graduate people.
All right, I have a ton of questions now.
Go.
Okay. So, students would first complete their
Basic.
bachelor's program,
Well, yes. Yes.
somewhere,
yeah.
and then go to. Would they take their first 2 years of medical school in Augusta?
First 2 years are either in Augusta or Athens.
Okay.
Either one. And then what you do then is they make a decision as to where they want to spend their last 2 years. And they can apply to our campus.
All right, so they have some say about
Yes.
where they want to do the last year.
And that's what we want. I really don't want students that don't want to be here. Yeah, and we have now, we've got a pretty good track record, so we usually have 3-to-1 ratio. In other words, I'll get 3 applications for every 1 slot I've got open. So we have a good chance of getting some really good students in this area.
And how many do you accept?
This year we're taking 10 on our campus here in town. We hope that in the next couple of years we'll be expanding that to 12 here in Rome. And we're actually going to be expanding to 12 in the Dalton area using the same sort of teaching methods within the next year.
So that would be a new campus or an additional?
It would be an additional addition to our campus.
I see.
Yeah.
Okay.
Our campus, where my students range, basically runs from Atlanta to Tennessee to Alabama. We're the northwest corner of the state. But most of our students in the Rome campus do all of their studying right here in Rome. And the students in Dalton will do all of their studying up there in Dalton.
And the students that you would have, the 10 and then possibly 12 students, do they select their specialty area before they come, or is that something that happens along the way?
That usually happens within the first 8 months of them being here. And that's one of the advantages to our program, is because by the time they get to 8 months of being here, they've already been in each one of these departments. So they can make their mind up much easier as they want to be a pediatrician or, internal medicine or whatever.
All right, so they have a little experience here before they commit.
Yeah.
So their clinical experience here takes 2 years, and assuming all goes well, they graduate,
Right.
and then what happens?
Then they go off into residency. And residency is an interesting really phase of their life. And that is where they get the training in whatever specialty they want to go into. So, for example, we've had some of our students graduate and go to Johns Hopkins. We've had some go to the Mayo Clinic. We've sent them all over the place, actually. Emory, Augusta, you name it, our students have gone there. And that's where they get the specialized training in whatever field they want to go into.
So the places that they end up going for residency, is that totally, I mean, I'm assuming they're applying at different places that they're interested in, or
They do. It's very interesting how they do that. It's something called the residency match. And what happens is that during the 4th year, they apply to all of the places where they'd like to go. Now, most of our students wind up applying to over 50 places. And then they will go out and they will visit some of these places. They'll interview at some of these places, like looking for a job. And then they'll also, if they're lucky enough, they'll get to do an elective rotation at some of these places. And I tell my students to go ahead and do that, because you want to know if this is a place you want to spend the next 3, 4, 5 years of your life. And they do get to go in and they find out, where's a good fit for them. Then they put in a list into a nationwide computer of where they want to go. And then each one of the residency programs puts in a list in that same nationwide computer of the students that they would like to have on their campus. And then the computer magically marries them somewhere out there in cyberspace. And then on National Match Day, they find out. And that's going to be March 20th this year.
it's sort of like a medical tender. Not that I know anything about Tinder.
Well,
but,
we hope it's swiping right, left, I don't know. So,
All right, we need to take a quick break here, but we will have much more with Dr. Reeves right after this, so don't go away.
7,000 high school students drop out every school day. That's a line of desks more than 4 miles long. We can keep students in school. Visit boostup.org and take the first step.
Welcome back to Community Watch. I'm having a conversation with Dr. Leonard Reeves, who is, I'm going to take a breath here, the Associate Dean of the Northwest Clinical Campus of the Medical College of Georgia at Augusta University.
but in Rome.
But in Rome.
Yeah.
And that's part of the title, but in
well,
Rome.
yeah, but in Rome, yeah. You know, I was born and raised in Rome.
Ah.
And so when I went off to medical school, I worked in Hawkinsville, Georgia for a while. If you don't know where that is, that's okay. But if you drive up 75 going back and forth to Florida, you'll see like 8 exits for Hawkinsville. It ain't that big. But the whole roads lead there. And I also had an office in a little place called Rhine, Georgia. I don't know if you never heard of Rhine, you are in the majority. It was a little town that when they told me they were setting me up an office over there, I said, well, fine, let me go look at it. And I got there, it was a double wide mobile home. And I'm not talking about an office mobile, I'm talking a double wide mobile home. And we wound up taking the living room, turning it into our waiting room. The little breakfast area was our triage area. The kitchen was the lab. The master bedroom was where the front office was because you could lock it. In those days we had paper charts, so you needed to be able to lock those away. And they put those in a walk-in closet. And then all my exam rooms were the bedrooms down the hall. So yeah, I've been a redneck doc for many years. And I was able to come back to Rome and practice here in town, out in the Coosa community for a while. And then I was with the residency program here. I actually graduated from the residency program here.
Really?
Yeah, the one at Floyd.
How about that?
Yeah. Of course, now, I mean, gee whiz, you've got the resident program at Floyd, you've got internal medicine at Redmond, you've got a transitional year residency at Redmond, and there's new residencies opening up in Dalton for internal medicine. And so, I mean, the experiences for would-be physicians and physicians in training is just fantastic in Northwest Georgia.
Well, it makes such sense for Medical College of Georgia to want to have a campus here with the hospital community and.
Well, we had to talk them into it.
Really?
Yeah. You see, when we started on this, and I say we because I was lucky enough to be part of the planning group of this, we saw that Augusta, Medical College of Georgia, had just opened a campus in Albany, and that they were opening a campus in Savannah. And so several of us at the Chamber of Commerce, including my good friend Paul Ferguson and Frank Barron and Dr. D. Russell, got me involved in helping to plan this whole idea. And so we went to the Medical College of Georgia and said, well, if you're doing it down there, why don't you do it in Rome? And they said, well, let's talk about it. And then we had people from Mercer to come up and talk with us. And of the 2 plans of what they had laid out, we went with the Medical College of Georgia. And I'll be honest with you, I graduated from Mercer. So, but the MCG had the better plan, and it fits very well with what we need in Rome. And so we are trying not only to bring students here, but the overall goal is that when they finish those extra years of training, that we'll get some of them to come back and practice here. And we have been able to successfully lure some people back into the area. Right now, one of my early graduates is actually practicing in emergency medicine in Chattanooga. So we're getting people slowly to come back. But Rome is a medical hub that is, I call us the best kept secret in the state, to be honest with you.
So is there much interest in the students that you've had? And it's almost 8 years now, right?
Yeah, this will be our 7th graduating class, and they fall in love with the area.
Yeah.
And what's nice about our campus is that they don't ever have to go back to Augusta for most things that other students have to. We do all our testing here, and we support them during that 4th year too. We try our best to help them as they're trying to make their decisions about where they need to go. We help them write their personal statements. I write their dean's letter every year. I got to tell you, we've had some wonderful students come through here. Now, your viewers may actually have seen some of them because they work with doctors at Floyd, they work with doctors at Redmond, they work with doctors from the Harbin Clinic. And so if you see a young person, and they seem to be younger every year, maybe it's that I'm getting older, but I don't know, with a white coat on that has a round patch on one side that says Medical College of Georgia, and on the other side maybe sort of a tan patch. That's what I give them for being the Northwest campus. And if you've seen those folks, you've seen a Medical College of Georgia trainee here in town.
I think the idea of having students come to Rome is great, and even better if some of them ultimately get to stay.
That's what we hope, is that eventually we'll have doctors. 'Cause, you know, look at us. I mean, you and I both. We got a few more years in us.
A couple.
But you know, eventually, I would like to retire. You know, at some point in time. So I'm going to need somebody to take my place. And so same thing goes for our favorite family physicians, internal medicine docs, everybody in town. And so while we now have a very good number of physicians in town, we're all getting older, and that number could drop precipitously if we don't do something to get them back here. So that's what we want our students to do, is come back and join us.
I'm curious to hear more about the longitudinal method that y'all use. Obviously, you believe that the students get just as much experience in the different areas.
Our students do, and not only that, they carry the information over from one area of study to the other. The nice thing about it is, today it seems like healthcare is so fragmented. You know that if you go to your doctor and they send you to somebody else for this test, and you go somewhere else for that test, and it doesn't seem like anybody really knows who you are, no matter where you go, and that sort of thing. I had a good friend of mine recently went into the hospital. She said she saw 17 doctors. Nobody told her everything that was going on. And so I'm like, gee, that's just wrong. Don't we want a doctor that knows us? Don't we want a doctor that actually knows when you've been in the hospital, knows that what your allergies are, that actually cares about what's happening to you? And so the only way you can foster that, in my belief anyway, the only way you can foster that is to actually get students paired up with patients so that they get to know their patients. You know, my one student that went off to do ophthalmology, I said, I am tickled that you're doing ophthalmology. I just want you to remember that when you're looking in that eyeball, there's a person connected to it. And that's the key. You know, if instead of being treated as a heart or a lung or an eye or a kidney or whatever, let's treat people as people. And that's what we're trying to instill when we talk about the longitudinal program.
And how are the students connected to the patients? I mean, how does that process work?
Well, we make them follow 2 pregnant ladies, And then I make them follow 2 surgical patients. One surgical patient can be something like a gallbladder or a quick, appendix, something that's quick and done and over, so that they see that side of surgery. But I also want them to follow a cancer patient. And what they do is they see that patient when they first get their diagnosis. Then they follow them over into surgery if that's what's needed. They present them then to the tumor board at the hospital because they have meetings every week. And then they go with them over to oncology or hematology, or they go with them over to radiation oncology. And they follow that patient all year long. And so what the students do is they just introduce themselves and say, I'm going to follow you through this. And in doing so, the students and that patient sort of create a little bit of a bond there. And I've actually had students have patients call them up to ask them questions.
Yeah.
I had one student that actually a lady was having to move and she was expecting, so he went over and helped her move from one house to another. These are things that indicate the humanity that we all have, and that is sometimes lacking these days. Yeah. And so we try to have the student, and they have to get in touch with their patients every month, and they send me a report. So it may be something as simple as just calling them up on the phone saying, how you doing? Or it may be going in with them for their next treatment option. So they have to stay connected all year.
Now, do you identify these patients through the physicians?
Yes.
Is that how that works?
Yes, and what we find is that the patients enjoy it as much as the students do, because the patient then says, "This is my medical student," and they'll call them by first name and that sort of thing. So they actually feel like they're getting to know somebody. Yeah. And we let the doctors pair them up, right. The surgeons, the OB, and also students, if they're interested in something else, can pick up patients on their own, as long as they tell me about it, and follow them for an interesting neurological complaint or, some kind of autoimmune disease, something like that.
Well, it seems like such a good way to do this. I mean, those students become essentially family.
Basically, they do, and that's the nice thing, and that's what sort of touches my heart through all of this, is that we actually see students treating people as people, rather than as a disease. Instead of just saying, "Oh, there's an appendicitis in room 3." Right. There's Miss Smith with appendicitis in room 3.
Well, I'm sure that carries on when they go into their residency as well.
It does. It does.
Well, we're coming up on a break. When we come back, we'll give you some contact information. So if you want to find out more about this program, you'll be able to do that. So don't go away. We'll be right back.
Eva Marie smoked 12,000 packs of cigarettes over 15 years. She quit, and now there's a new lung cancer screening that could save her life. You stopped smoking, now start screening. No matter how much you smoked, early detection could save you. Talk to your doctor or learn more at savedbythescan.org.
Welcome back to Community Watch. I've been talking with Dr. Leonard Reeves, the Associate Dean of the Northwest Clinical Campus of the Medical College of Georgia at Augusta University, but in Rome.
There you go. That right there took up all the time we had
Almost,
left.
Yeah. If anyone wants more information about your program here in Rome, how do they reach you?
A couple of ways. One is we're on Facebook, so if you want to look for MCG Northwest Campus, we're on there. We also, you can, if anybody's interested, you can actually email me at lreeves, that's LREEVES, at augusta.edu.
Well, that's
and that'd
great.
be fine.
Well, thank you for being with us. Thank you for being with us, and we will see you next time on Community Watch. Bye now.